My name is Seema Khosla. I'm a pulmonologist from Fargo, North Dakota. My journey to sleep started actually in the intensive care unit. So when I finished my fellowship, I joined this hospital and I did a lot of ICU medicine. And one of my patients happened to be maybe 5 or 6 years older than I was. And he came into the ICU with profound right-sided heart failure and wound up being intubated, wound up getting trached. And I remember when he graduated to the medical floor, I went out there to swap out his trach, and I just very casually sat on the side of the bed, and I said, "What, so you couldn't just suck it up and use a CPAP?" And he looked at me and he said, "No, I couldn't." And that was a light bulb moment for me. It made me recognize that this is a really important thing for us to do, and we need to be better at treating it outpatient before we are letting people decompensate and come into the ICU and almost die from this. So I think my trajectory has been probably a bit unusual. When I was a resident, I actually trained under Dr. Barb Phillips. But even though I had this great resource right there, I didn't really understand that sleep was its own field until my 3rd year of residency when I went to sleep clinic. And so it just was such an epiphany for me. My first night being on call as a resident or an intern, I remember falling asleep at a stop sign on my way home. And somebody had to beep their horn at me. And my immediate response was, I am such a good little intern. I fell asleep on my way home. And it took me probably until my fellowship to recognize how harmful that was. So I started in pulmonary, did a lot of critical care, and one day I got a phone call. And, we always get these phone calls from recruiters, and I was, maybe a couple of years out from graduation. And somebody said, "Hey, do you want to come and do sleep full time?" And I remember putting my hand over the receiver, and I asked my husband, I'm like, "Honey, you want to go have free dinner?" And he's like, "Sure." And so we went and we had dinner and we met these 2 men that had a sleep company, and I moved to Fargo, North Dakota. And I've been doing sleep ever since then. So we have been doing sleep telemedicine since 2008, and we did it old school. We applied for a grant. We had a $400,000 USDA grant, and we physically purchased, now looking back, these gigantic TVs that sat on carts. And our nurse would drive out to a town and would bring in a cart and room the patient, and I would see them from my office in Fargo. And so we had been doing this for quite a long time. And randomly, a few years later, somebody phoned me, Dr. Chuck Sherrill, and he said, "Hey, will you talk to us about your experience with telemedicine?" I said, "Sure." So I chatted with him on the phone for maybe half hour, an hour. And then maybe a year from then, I was invited to participate in a telemedicine task force, which then became an implementation guide. And that was probably a decade ago. And I am still very close friends with the people I met on that initial task force. So then from that task force, it turned into a committee, and then another committee, and then another committee. And I kind of joke about this, that I am the guinea pig for the ASM. And so if they have a project that they think may or may not succeed, and is, probably low risk, but they'll just say, "Let Seema do it." And so when we started doing different things at Trends, when we started doing, just different ideas, they would just kind of ask me to do it, and I would do it, and that was kind of it. So early COVID, I received a phone call. I think I was, at a game or something like that outside, and Thomas Heffron from the ASM, we had a 2-minute conversation. He's like, "Hey, do you want to do a podcast?" I said, "Sure." And that was it. We had no plan. We had no agenda. We had no curriculum. We had no budget. We just kind of started it, and that's where it went. So I think I am low-hanging fruit, because I will pretty much, I think they figured out that if Thomas asks me to do something, I will just do it. And so I actually learned the term voluntel through my work at the ASM. And so on a committee, if there's some heinous part of the job, somehow that would sort of fall to me to edit or to collect all this data or to round down the people that hadn't contributed their part to the project. So it's funny, whenever I take on something new, I learn a ton. And so this podcast thing was pretty new to me. And so I relied heavily on the people that supported the podcast from the ASM side. So Mike Lissy is our audio engineer. And we learned through, I think, a lot of trial and error that I needed to be really cautious with my dogs. I have 2 giant labs, and invariably you can actually see the audio wave from their snoring. And so then I'll have to subtly sort of wake one of them up so that they quit snoring during the podcast. And we kind of learned about the ability to ask the questions of our guests. And if something maybe goes a little bit unexpected, we've had a few guests say things that perhaps were not suitable for air. Just to quickly send a text to the podcast team to say, okay, mark that time, we need to edit that out. And it's really funny. One of the tricks we started doing was just to let the tape roll after the conversation, after the official interview was done. And we have caught these magical moments where people are just really genuine. And you can see that invariably anybody that we have interviewed has such passion for this field. And I think that's one thing that I've always really been drawn to, is that our field is small, right? And the giants of sleep medicine, for the most part, are still alive and practicing. And they're reachable. And so we often joke that, if you don't know somebody in sleep, you probably know somebody that knows that person, right? So we're all very connected. And it feels like they are also very willing to teach you something. Every time I meet somebody that's been in the field, this morning I learned some interesting facts about NPT that I had never known before. And it's it just adds to this rich tapestry that is our field. I have really appreciated the opportunity to even meet a lot of people. One of my personal heroes, Dr. Mignot, was a guest about a year and a half ago. And he was so down to earth. Here's somebody that just had won this $3 million award. He's somebody that I'd read about since early days of my sleep fellowship, and he was telling me about his dog with cataplexy. It astonishes me how many people are so smart and yet remain so humble and approachable in our field. So when we prepare, I'm a detail girl, and I like to make sure that we are prepared, for our guests. So I will spend time with them, usually about an hour or so, a week or two before the actual recording, and have these really rich conversations, because I want to make sure that I understand their view on the topic and that we are respectful of that. And we recently interviewed Dr. Alyssa Cairns, who was teaching us about the value of a sleep onset REM period on the overnight polysomnography. And then partway through the interview, she shared with us that she actually has idiopathic hypersomnia, and how that really motivated her to go further in this field. She started off as like a sleep tech, and then she was able to advance. And the day that we were supposed to record, she actually called me because she had a migraine, and was so willing to just push through if we needed her to. And that has always just remained with me, because it was very, easy for us to reschedule. We wanted to make sure that she was well rested, but she had already valiantly tried to get rid of this migraine, and she was just so gracious about it, where she said, oh, I so appreciate you guys being flexible and letting me, record at a different time. And I felt that it was such a brave thing for her to do, to be vulnerable and to trust us with something very deeply personal to her. And I feel like it's these stories that we hear that make what we do incredibly meaningful. We're not just looking at squiggly lines, right? How do we let those squiggly lines help us improve the life of a person in front of us? And I think that is such an important touchstone for us. When I struggle with which decision to make when I'm with my clinic patients, I always think about, well, if this was my mom in front of me, what would I do? And then right away I have clarity about the right thing to do. So one of the things that I kind of joke about that is incredibly humbling about recording this podcast in my home. I have these, 2 big dogs, and one will be on the couch and one will be under the desk, underneath me. And when they snore, I a sleep doctor in private practice for 15 years cannot figure out which dog it is. And so then I have to make sure that I, wake them both up, because I want to make sure that that sound doesn't go through. And it was so funny because just maybe a few weeks ago, one of my colleagues said, "What is that sound?" And I was like, "Oh yeah, that's my dog snoring." And I didn't realize I picked up on Zoom too. And so it's something that, we've definitely had to learn to work through, and the team is very patient. If my kids come home, there's this, 5 minutes of this cacophony of noise, and the kids come home and they say hi, and we all pause the recording, and they come in, they know what to do. They come in, they take the dogs, they close the door, and they leave. So the entire household has been very well trained for how to do a podcast from home. So one thing that I really have appreciated is that even though I am a solo practitioner that is not an academic person, I'm not affiliated with any sort of, facility that does academics. And so for me, I like to look at things from a very sort of, how does this affect my day-to-day practice? And there's been, people have been willing to listen to that. And so one thing that I am worried about with our field is that for so long we've been so OSA centered, both in terms of what we do day to day, but also in terms of our revenue stream, right? It primarily comes from testing. And it just feels like we are in this race to the bottom, where home sleep apnea testing is getting less expensive and less expensive. And I feel like we need to think beyond OSA. So primarily because there's so many more sleep disorders that we need to be able to treat. But then it also becomes a matter of, well, we need to recognize that there's also this really important financial component that if we don't address, that we're going to have more and more sleep clinics closing and fewer people coming into our field. And it's funny because as a non-academic, sometimes I feel like maybe I'm focusing too much on this financial piece, and maybe because that is something that threatens my day-to-day. But I've appreciated that when I talk to people within the ASM, that they're willing to not only just let me get it off my chest, but then they'll say, okay, well, what do you think we should do about it? What do you think the next step is? What else do you think we need to consider when we're doing this? And so there's been this receptive audience. And even if they don't have the answers, right? I think that's okay, because I at least feel like we are aligned, right? I feel like they're not just pushing back against me to say, oh, nope, I don't want to hear that. It doesn't matter when we are in like this gigantic, facility, this academic facility. I feel like even though they can't tell me right away what the plan is, that they will at least try to think about what I've said as they implement the next stages of their strategic plan. So one thing that I have missed since being in private practice is not only the ability to collaborate with colleagues, but there's a little part of the academics that I miss. And so being able to work on position statements and papers and feel like I'm contributing meaningfully to advance our field is something that I feel like I'm able to do through the ASM. I don't think it's something I would have just been able to do on my own. I feel like I needed to understand how the process worked and how could I then collaborate with other people that had similar ideas. And it's always amazing to me that no matter how good something is that you think you've written and you're really, really proud of it, when you let somebody else look at it and edit and contribute, it's always better. And so that is something that I've really learned to cherish about these involvements that I have within the ASM. So if I could look into my crystal ball and think about our field, and I do this. I have 3 children and my youngest is 14. And ever since they were little, they would sit on my lap and read sleep studies. And so it got to the point where all of my kids could pick REM out on a sleep study, and my youngest actually became the tiebreaker for us. So if we had an MSLT and we really struggled about, is this sleep, is this wake, what is this? Our tech would say, maybe we should ask Sophie. And so it just kind of became something that is important to us as a family. And so when I'm thinking about what is this field going to look like for my daughter, I have to think that it is going to continue to grow. I think we have finally started getting that message across about how important sleep is. So not just identifying and treating sleep disorders, but sleep overall. And there are so many people that talk about neuromodulation and all of these things that are done during sleep and how sleep is the superpower. And I'm hopeful that we will continue to be able to collaborate with non-sleep people, our cardiology colleagues and nephrology colleagues. And, historically we've kind of been in the silo, right, where we're relegated to outpatient care. And I'm hoping that we will be able to make those inroads. I think the AHA statement, where sleep is part of the heart's essential 8, is huge. And now the onus falls really to us to continue to be worthy of that designation. And so I think that as we continue to think outside of the OSA paradigm and we start thinking about how sleep impacts our brain health, and is there a digital signature within that EEG that maybe can identify people at risk of dementia? Or should we be thoughtful about when we take our medications? Depending on your circadian phase. Is this medication going to work better for this person at 8 p.m., but at 8 a.m. for the other person? And really explore this idea of circadian and sleep, and not just sleep regularity and duration, but is there a way that we can look at the quality of sleep and improve that in a really meaningful and attainable way? One thing that I have said, and I'm sure people have heard me say this over and over again, is that I've always felt that the ASM was very forward thinking. So we collectively had thought about sleep telemedicine before COVID made it cool, right? So our position statement and implementation guide are now, 10 years old? And so I appreciate that leadership like Steve Van Hout has always been very forward thinking. And I think when you're able to do that, you're also receptive to what other people are saying. And so I've seen people talk about DEI, for example, and it wasn't just something to say with the ASM, they implemented it. And then you could see this change. You could see when they changed how the nominating committee worked. They made these really intentional changes to respect the tenets of DEI. And so it's really important not just to be able to, say what people want to hear, but to kind of walk that talk. And I feel like I get that from the ASM. Well, kind of judging by how many people are here today at APSS, which I hear is a new record, I feel like our organization will continue to grow. And I don't think that that's just driven by physicians. I think it's because the ASM has been so willing to, bring everyone in under the tent. So lots of APPs and techs and patient advocates. We had this patient advocate on our panel yesterday, and he went in front of this group of, there must have been 100 or 200 people in the room, and told his story and allowed himself to be there, potentially. I mean, that's a nerve-wracking thing to do. And he was so generous by allowing us to have that insight. Sleep is very intimate. When we think about who it is that we allow to see us sleep, it's people that we are really close to. And so for us to ask our patients, for example, come in, sleep in this room, we've got a bunch of strangers and a bunch of wires and that sort of thing, right? I mean, that can be a hard thing to do. And I feel like when we go to sleep, right, we let down our guard. And so there's just this incredible generosity from our patients to allow us into that space. And we saw so much of that during COVID, where we literally were allowed into their bedrooms, right? And so I feel like it's been something where people are more willing to let down their guard. They're more willing to engage in conversations. We're seeing larger groups of patient representatives. We're seeing larger groups of APPs and technologists and people from, not just neurology and pulmonology and internal medicine. We're seeing more cardiology, right? We're seeing these different fields that I hope continue to be welcomed into the world of the ASM. I hope that the ASM will continue to not shy away from change and not dig in their heels. I hope that they will continue to listen to what people are saying and continue to advocate. Um, there's a lot of things about the ASM, that are already pretty good. So I hope they don't change that idea of, the collective is stronger than the individual, and that all of us are part of this world, right? We all have our place within the ASM. We all have our place within the world of sleep. And, for some of us, it's a little bit hard to claim that space, right? Because we feel like we don't deserve it if we don't have this pedigree, or we don't have, the right sort of history to get to where we are. And so I feel like they have been very welcoming of people, whether you've done this traditional academic route or you've done this non-traditional route. We're all here to learn from one another. I think one thing the ASM could be better about is communicating the wins. There is so much that goes on behind the scenes that a lot of us have no idea about. And so I think it would be helpful to know what those wins are, whether they're legislative wins or procedural wins or insurance wins. Not in a way to be splashy and promotional on social media, for example, but just in a very fact-based way to communicate to the membership that we hear you. This is what we have done to address this issue. This is the legislator that we have approached. This is the letter that we have drafted. I think a great example of this is a sleep technologist shortage. So this is something that we have been talking about for a number of years. A few years ago, I presented to the board about the sleep technologists, and New York, for example, has this really funny rule where you have to have this very specific degree, this associate's degree in polysomnography. And yet there aren't enough schools. In New York, they had 4 and they closed, and now there's 2. And, 14, 15 people get licensed a year, and half of the people that are licensed have retired. And so it's a really real problem. And so they were willing to let me, talk about this with some of my colleagues. And so I was satisfied that they heard me. But then the next year, they launched this presidential sleep technologist shortage task force. And so those types of things don't happen in isolation, right? That's not just one person deciding to put this together. This is them having discussion behind the scenes and then taking this into consideration and then recognizing that this is affecting a lot of our members and then prioritizing it. So if I had to kind of choose out of all of the ASM leaders that have affected me, I think Steve Van Hout comes up on top. He has always been very approachable, even before he was executive director. And I always felt like he was willing to listen. We didn't always agree, but he was willing to hear me. He didn't just shut me down. Thomas Heffron is another one that he's kind of my go-to person. But really these friendships, Doug Kirsch was president years ago. And I've learned so much from him, and he's kind of encouraged me to volunteer and to be part of these committees. Faria Abbasi Feinberg has always been encouraging me. Every year she'll send me a text about something board related, and she'll encourage me to do more involvement or more volunteer work. Kelly Carden is a leader that, when she was president, just her style of leadership, in fact, Faria and I were just talking about this today, her style of leadership was effective without being overly forceful. She was able to make you feel heard. She was able to make her way in leadership as president. I thought she was very effective, and she's someone that I look up to and admire. And of course, Dr. Larry Epstein, who I've known him for a very long time. He has asked me to call him by his first name, and I just can't. And so he has been very influential. He made me feel like it was okay for me to be here. Chuck Sherrill actually told me that one year, many years ago, when I had so much imposter syndrome. And he looked at me and he said, "You deserve to be here." And he just, I don't know how he knew what I was thinking, but he just came right up to me and he said that to me, and that was life-changing for me. The AASM is my home. It's somewhere that I never thought I would be. I think it's been very inclusive, very encouraging, And it is so lovely to just be able to feel like I am part of something bigger than me that has been here longer than I have, that will continue to exist long after I'm gone. The future one's hard.
Yeah.
Mm-hmm. But you know, I feel like it's so important for us to understand these stories that people who have been on this road longer than we have, it's important for us to understand these stories so that we can continue what they have started as we move forward. You know, today when Dr. Karskadin was telling us about, you know, different things, it was so important to hear her experience and the things that she just took for granted that I had no idea about. You know, that's how we fill those voids, and that's how we continue to move forward in a very robust way. So we're not just repeating the things that have been tried and failed in the past, but we're truly learning from it and moving forward.